Hello again to everyone. Good afternoon and good morning to folks who are joining us from the West Coast. We'll get started shortly as folks are joining us. I'll just introduce myself. I'm Kashana Hill, Executive Director of the Redress Movement, and we're very excited to have you all with us today. Thanks for taking the time to join us. We are expecting a fantastic and very exciting conversation, and we are honored that you have chosen to spend time with us today. We will get started very shortly. Thank you for being here. Welcome, everyone. Thanks so much for joining us today. I'm Kashana Hill. For those who are just joining us, Executive Director of the Redress Movement. We are so excited to have you all here with us today, and we will get started very shortly. Hello, and welcome again to today's conversation. We are going to go ahead and get started, and we are so excited to see so many friends with us today. We thank you very much for joining us. Today's conversation is Lessons from the Field, Redressing the Impacts of Housing Segregation on Health. For those of you who have just joined us, welcome, good afternoon, good morning. Thank you for being here today. My name is Kashana Hill, and I have the honor of facilitating today's conversation. I am the newly appointed Executive Director at the Redress Movement. I'm honored to be serving in this role and honored to be here with you all today. Thank you so much for everyone who has taken the time to join us for this very important conversation. And thank you to our incredible panelists for all of the insight that you're going to share. We are incredibly thankful that you have chosen to spend time with us today discussing this very important topic. So as we get started, a little bit more about the work and setting the stage for today's conversation. We're so excited at the Redress Movement to be able to bring these conversations where we share lessons from the work that we are doing, engaging local communities around direct actions that address and remediate the very harmful and ongoing impacts of residential segregation in communities across our country. Today, we are so excited to hear from practitioners in the field who are very clear about the fact that racism, housing segregation, and inequality contribute to health outcomes that drive disparities across the course of lives. And so we're so excited to have this conversation today. Those of us who have chosen to dedicate our careers to this work understand that the impacts of residential segregation are ongoing and are harmful across many areas of inequities. And so we're really excited today to drill down on the ways in which our history of residential segregation and discriminatory housing policies have impacts on the disparities in health outcomes for communities across the country. And so today, we are going to hear from experts in the field. Megan Sandel, a pediatrician and co-director of the Grow Clinic at Boston Medical Center. We'll also hear from Shoma Shaha, President and CEO of the Well-Being and Equity in the World. We're going to hear as well from Marjorie Givens, co-director at the County Health Rankings and Roadmaps at the University of Wisconsin. And we'll hear today from our discussant who is joining us, Abby Kofsky, Managing Director at the Robert Wood Johnson Foundation. So again, we're so excited to hear from the panelists and hear what you have to share with us today. I think it makes sense to just go ahead and get started. We'll also have plenty of time for audience questions. So I do want to note that attendees should use the Q&A box to share any questions that you might have. I will certainly have some questions of our panelists throughout the course of the conversation. But again, we do want to hear questions from our audience members as well. So those of you who are attending today, if there's anything that sparks any questions for you, please don't hesitate to throw those questions in the Q&A box, and we will make sure to get to them later on in today's conversation. So with that, I think we'll start in the order in which folks were introduced. And I'd like to ask you to spend some time each talking about your work and that work's relationship to community health and housing segregation. So as I mentioned, you have all worked very closely in community to address health inequities and understanding, again, that intersectionality between residential segregation and health outcomes. And so I'd like for you all to chat a little bit more about the ways in which you've worked extensively with community leaders to address the effects of housing segregation, racism, and inequality in health outcomes. If you can, please start by sharing why this work has been so important to you and how it's been received. And Megan, we'll start with you, please.
Thanks, Kashana, and good morning, because I'm from the West Coast right now, but I just wanted to thank everyone for coming today and to be in community today around this issue, because it's really, really important. So I'm, as Kashana said, a pediatrician. I treat kids, and in many ways, more and more, as I think about what's impactful, what are things that we need to do as a health system to help people be healthier, it really is about helping the communities they live in be healthier. And so what that ends up kind of translating to for us is, as we're thinking about honestly the maps, right? Like, you know, so the city of Boston has a map that many major cities across the country have, right? Where the central core city, for us, that's the neighborhood of Roxbury, and Dorchester, and to an extent Mattapan, light up red, right? That was where the red lines were in the 1930s. And so what we will do now is, as a health system, we will, you know, leverage our public health data from the Boston Public Health Commission, leverage some of our data that we have in our electronic health record. And the reality is that map, whether we talk about diabetes rates, whether we talk about firearm homicide, it's the same map. And so when we, as a hospital, we are what's called a safety net hospital, we disproportionately serve low-income people. We were recently named the most racially inclusive hospital across the country by the Loan Institute. We have a front row seat for how that segregation, how that economic system continues to reverberate a century later, right? And so for us, it's an interesting dynamic around what is our role then as a health system in trying to help those neighborhoods. And I think that in many ways, we as an anchor institution, right? We like to say Boston Medical Center, we've been in Boston for 150 years. We're going to be in Boston for the next 150 years. That what's our role in being able to address that economic inequity? I'm joining this webinar from the West Coast because I'm at the Healthcare Anchor Network meeting, where we are really trying to apply our economic power to address that inequity through place-based investing, place-based hiring, place-based procurement, and what are the ways in which we can bring economic activity to redress some of the inequities there, and to be able to use our economic power in that way so that the communities become healthier. And I think that in that way, it's less about segregation for us, in the sense of, like, if it's a majority Black neighborhood, we're happy with it. We just think it should have the same economic opportunities that every place has in order to be able to have a grocery store, to be able to attract businesses, to be able to build housing, to be able to build generational wealth. And so what are the ways in which we try and apply that power moving forward, so that we can be more effective and just looking forward to talking more about how we're understanding that through our data, through our programs, through our policy work to try and make a difference. So thank you.
Thank you so much, Megan. So much more to get into, so I really appreciate that. And Shoma, you made it back just in time. If there are any tech challenges, no worries. I certainly understand that. But I'm really excited to get your perspective here. And, given that the work that you do is really global in scope, which is just so incredible. And I know that we'll talk a little bit more about some of those global examples, but if you can just share with us the ways in which you've been really rooted in community at well-being and equity in the world, that would be great. Thank you.
I'd be happy to. And well, I'd say that our organization is global. Sadly, so is racism and structural inequity and a false hierarchy of human value. And, I remember growing up in a part of the town in India, looking out at shanty towns. Our part wasn't particularly the wealthy part. We lost electricity every night. But in front of me, you'd see shanty towns filled with people who were brilliant and resourceful and creative, and existed under a caste system that said that they deserved less, that they needed to be segregated into neighborhoods because they weren't part of a same social class and didn't deserve to belong. People needed them to do the work and the labor, so they needed to be somewhere close, but not among us. They were not with us. And if you go around the world, whether it's Cape Town, around all across the US, you see that pattern of segregation and dependence that requires and sustains a false hierarchy of human value that says a few people should have access to great wealth and power. They need lots of other people to work the land so that they can have the wealth and power. But in order to maintain and say that that is something that is okay, we preserve and sustain narratives and then encode that into structures and systems that lead us to unequal outcomes. And I say that not from a place of, I say that at this point, as somebody who started as a primary care doctor like Megan, working in communities all across the country, seeing that, while we could take care of a person, one person at a time, because I was taking care of people in generations, you could see the span of what happened to people over time as they grow up in these neighborhoods that didn't have what we call the vital conditions they need, and what it meant to understand and decode why these neighborhoods were there, why in the first place. And, in our work at Wellbeing and Equity in the World, as we in a very practical way say, how do we actually create generational change to create the conditions for everyone to thrive? We know that we can't do that without addressing that hierarchy of human value that's encoded in the policies of segregation and ownership of land, of housing, in all these areas. So if it's okay, I'll share a couple of stories that I found, and these are all from the last 2 weeks. I was in Eastern rural North Carolina with 3 powerful Black women farmers about 2 weeks ago. They're part of one of our initiatives called Communities Rise Together, which helps communities all across the country say, how do we understand these legacies and do something? A big part of that is saying, what do communities know? And these 3 powerful intergenerational Black farmers had the numbers at the top of their head. They said, there are less than we all worked the land. We were the sharecroppers after first in slavery, then as sharecroppers. And then we became the people who are now less than 2,000 of the 50,000 farmers here in North Carolina own our own land. And as they talked about that, and others in health systems joined them as we thought about what we could do to change that equation, we realized that the health systems realized that they had a lot to offer, but to offer that, they had to be really have a very clear understanding of those legacies of segregation, of the legacies of racism, and to be able to talk about that, not from a place of shame that shuts you down, but from a place of how might we do something differently. And one of those health systems, um, in that same visit, approved a $20 million investment in affordable housing in one of the neighborhoods. And as I asked Tim Gallagher, who's the person who is leading that effort, why, what happened, and why, who's going to live in this affordable housing neighborhood? The thing that had shifted was that they had reconciled with their legacy. So he could say, this used to be a neighborhood place that we chose as a community that has acknowledged its legacy and wants to bring people back. This is where free Black slaves settled. And what we want to do is invest in this neighborhood in a way that those families that got displaced by the homeowners associations in this neighborhood, that those families could be welcomed back. And that the way in which we've changed the conditions of belonging in this community are shifted. There were others who lined up to say, in order to do this was great for Tim to do, but in order for those 3 Black women farmers, they needed access to things like capital in order to own land. And that's actually something that, if you look at the statistics, minority Black farmers don't have. And the reason that matters so much, this is about the intersection of these structures and systems with health, is if you look at those counties, they have the poorest chronic disease outcomes. In fact, I'd met one of those Black women farmers, Jessica Joyner, who's a niece of Richard Joyner, because I was in North Carolina doing a talk on population health or health system, and he was there. And his county was the 100 out of 100 in the county health rankings. Marjorie, I have to say how impactful those rankings are for people. And they've been slowly climbing out. But what that meant for them was that people were dying in their 30s and their 40s of heart disease and diabetes. And sometimes we look at the numbers and the rankings, but for the youth in that community, Jessica and her peers, what they cared about was the ability to have their parents with them as they graduated from high school. And so this investment in what it means to restore the ability of Black farmers to farm and grow their own food, to partner with faith communities for communities themselves to be able to eat that food, and the investment in capital and housing and land and supports to build pathways of economic development, and the work on policy development to work with the USDA and others to make sure that entitlements in the Farm Bill actually got to the people that it was needed. That's all a set of solutions that I think we need to be able to offer to communities if we're really serious about changing those rankings. That's what our work is.
Great, thank you. No, so many wonderful threads to follow in there, and we'll get to that. So thank you so much. But I really appreciate that sort of placement. And as I was listening to you talk, I was really reminded, right, that sort of when you talked about displacement, right, and it's because of sort of the needs of folks who are the people with the resources and the money, right, HOAs and things like that. I'm just reminded to your first point that racism is global, sort of what we experience. I think when it comes to displacement, and we're talking about Black folks, right, being moved from lands, it ties in, and it's part of, in my mind, the same sort of history of displacement that we saw beginning with, our indigenous family, right? When what became the United States was settled. And so as we do this work, it is important, I think, to think about it, right, on a continuum, because a lot of what we see has its roots in white supremacy, right? It's not new. This isn't a new problem. It's not a singularly American problem. And so I really appreciate you opening that up and clarifying that for us. Thank you. And so then segueing to you, Marjorie, in particular with what we just heard around how helpful, right, those county health rankings are. So please, if you could chat a little bit about your work and the ways in which it's community-based and received in community, that would be great. Thank you.
Well, thank you, Kashana. And I have to say, I'm already feeling the heaviness and the hope of this conversation. And I can't Thank you enough for the opportunity to be in this space. Good morning, good afternoon to everyone, wherever you are in your time zones. I do want to make sure to thank you, Kashana, for creating this space, and to the Redress Movement team for organizing and making sure we could all come together for this important topic and conversation. I'm really, really honored to join this distinguished panel of folks that we're going to have a conversation with. These are friends and fellow equity advocates that I've been an admirer of for quite some time. So really, I'm humbled to be in this space. My name is Marjorie Givens. As Kashana said, I'm joining you from the University of Wisconsin Population Health Institute in Madison, Wisconsin. This is the unceded land of the Ho-Chunk people. And I will keep my remarks slightly brief in terms of what we do here at UW-PHI, but I did want to make sure to give a little bit of context about how we come to this work. So at PHI, we envision a world where we value each other and honor our connectedness, and we're building communities where everyone can thrive. We want to be a part of that. So we strive to translate the research that we can and all the data tools we can bring for policy and practice to be in service of the people and their communities and where they come from to advance health equity. So PHI is also the home to the County Health Rankings and Roadmaps, as Shoma was noting. And so we short that hand that to CHR&R, so I'm going to use that so I don't have to repeat County Health Rankings and Roadmaps multiple times. But at CHR&R, we really seek the opportunity to work alongside partners and to bring those tools of academia to bear in efforts to grow community power and advance health equity. And so this looks like for us analyzing data and evidence about the drivers of health and equity and making them accessible for those who are making change in local spaces. We work to break down data so that we can show how laws and policies and practices have affected health and specifically disproportionately disadvantaged the health of racialized and minoritized groups. We work to evaluate different types of evidence to help people take action to improve health in their communities. And through virtual forums, we work to provide spaces where people can learn and exchange with a range of experts. So our aim is to join others who are working to inspire critical reflection on what's possible and to improve health and really sharpen an analysis, as Shoma was calling out, just acknowledging the legacies that are true and the reality of our nation. We seek really to advance a new understanding of data and evidence and to develop methods that can challenge assumptions and to explore possibilities and build collective power. So I do want to just acknowledge that County Health Rankings and Roadmaps is not a community-led platform in the sense that we are not in community given the scope of our platform, but we do actively seek out and listen to our partners who are in community, health officials, community organizing networks, and community development groups as we think about how we position our tools to be of service in social movements. So CHR&R is working within and informing an existing data infrastructure that's been established by federal agencies. And really that infrastructure is intended to help understand the patterns and trends of opportunity and health in our nation. And it is to support core public health research and practice functions. So I name that just to say it is something I'd touch on later if we had time, that has its own limitations in terms of being able to address some of the longstanding issues that we know are true in thinking about segregation, racism, and the health implications that's had for our nation. So when it comes to segregation, I'll just say, sad but true, but segregation, displacement, and violence is as American as apple pie. It's something that's been true in our nation since its inception. It's something that we all have had to grapple with and hold in tension. And Megan already alluded to this, but by way of example, when we look at a map of US counties, there's just repeated and longstanding patterns. These patterns are over decades, even centuries of advantage and disadvantage. These are the hallmarks of segregation. And it's across an array of social, economic, environmental, civic conditions. You name it. As Megan said, the pattern persists often. And when we put on a health and equity lens, these patterns definitely overlap with how long and how well people are living, and these inequitable life expectancy gaps that we're seeing among racialized and minoritized populations since the birth of our nation. And I'm happy to touch more on this as we go forward, but it's really important to note that, as has been said by my colleagues, these patterns didn't come about by accident or magically appear. These patterns in the data can they really reflect the structural inequities, the power imbalances that have been written and into our code, our structures of opportunity, and therefore have disadvantaged people in their opportunity to be healthy. So I'll just say, for us at County Health Rankings and Roadmaps, this is really important because we aim to be of support to those who are working to make a more informed and accurate diagnosis of core social problems, and to show how, like, the laws, policies, and practices that we know have been persistent and inequitable have implications for health, the health of our nation. So it's not just about painting the picture of the things that are wrong or broken. It's also about offering opportunities to make change, and doing that through evidence-informed strategies, through opportunities to organize together, and to really partner as we think about working to address these issues. And maybe just to finally say that while data and evidence are absolutely part of the powerful tools that can be possible with change, they don't speak for themselves. And we know that data and evidence are most effective when it's aligned with and coordinated around a social movement and campaigns. And it's why I am incredibly excited to be with you today and part of the Redress Movement.
Thank you so much, Marjorie. Also have some notes for you for later on in our conversation. So this is great. Thank you very much. And then Abby, we'll turn things over to you for a bit.
Sure. Thank you. Good morning, good afternoon, everybody. My name is Abby Kofsky, and I am the Managing Director for Healthy Communities at the Robert Wood Johnson Foundation. And for those of you that don't know the Robert Wood Johnson Foundation, we are a national foundation focused on health and building a culture of health. And I sort of both personally and on behalf of the foundation want to just express deep appreciation for Kashana's leadership and for the Redress Movement, because the question that you're asking, like the question that is at the center of this conversation, how racial segregation has impacted health and what do we do about it, is the question. I would say it really is. And, you know, I come to this work with a background in public health and, you know, can reflect on over the past sort of 10 to 15 years. We at the Robert Wood Johnson Foundation have really been on this evolution, sort of recognizing that, yes, the goal is to improve health and well-being and to sort of address health equity, right? To close those gaps. So that's the goal. And we care deeply about that goal. But the realization, I think, certainly from, you know, the folks that are on this panel, but I think from the field more broadly, has been more healthcare does not get you to better health, right? And that's sort of a foundational kind of understanding. And we have been on this journey to sort of say, all right, how do we get to better health? And there's been a focus on sort of recognizing the social, the economic determinants, and we often see those in place. And I too want to sort of give a shout out to Marjorie and the County Health Rankings, which, you know, has been such a pivotal part of our own understanding in terms of what are the many things that contribute to health. And it was in 2016 that racial segregation was brought into that platform. And that was a pivotal moment, because what it meant was that we weren't just talking about the conditions of place, right? The environment, schools, jobs. We were asking a structural question, pointing to the structure of, like, why are places fundamentally different? And, you know, that was critical. You know, Megan and Doma also referenced those life expectancy maps, right? Again, drawing attention to these deep inequities in health. And asking the question why. And I think we as a field have been on the journey of getting to why, and recognizing that part of that means that healthcare and public health leaders alone can't answer that question. Community needs to answer that question. Our colleagues that are working in housing and community development need to be part of those conversations. So I you know, this is the question. And I want to lift up a couple of years ago, the Othering and Belonging Institute put out a report on racial residential segregation as it relates to health. And they noted racial residential segregation as the linchpin in health inequities. And I want to just read this sentence because for me, it captured something so complex in a way that was so compelling and seemingly actionable. Racial segregation, by sorting people into particular neighborhoods or communities on the basis of race, that connects or fails to connect residents to good schools, nutritious foods, healthy environments, good paying jobs, access to healthcare, clinics, critical amenities, and services, right? And these aggressive broken window policy practices targeting racially, economically isolated Black and brown neighborhoods, while jobs and tax dollars flow to white communities, leaving crumbling infrastructure, poisonous water, predatory financial institutions, and food deserts behind. And again, in one sentence, it sort of captured the complexity and the many manifestations of racial segregation that impact those social determinants of health and health inequities. So again, just reiterating that is the question and where we at the Robert Wood Johnson Foundation have been, and I know my colleagues have been on the panel. How do we take action, right? Yes, there is a need to continue to draw attention, to these inequities and the sort of both historical and present day context, but how do we change, right? How do we, and that's why we're so excited about, where the redress movement is going and how it can bring together so many change agents, because it is about changing culture. We talk about changing the mindsets of, individualism and deservingness. Oftentimes we look at those bad health outcomes and we'll say that's that person's fault, right? It's their behaviors. How do we shift that, again, to be focused on these structural factors that often are not easy to see. We as a health funder have really sort of embraced this notion of working at the intersection of community development and community investment. Shoma's example elevated that, but that means we need to get out of our comfort zones. We need different partners. And in some cases, we need to recognize that those systems need to change too. So much of our work around community development and community investment has been like, how do we, lead with community priorities? How do you think about investment and development without displacement, and thinking about, again, housing policy. Very intimidating for folks that come to this work with, a background in public health, which is why, again, creating these conversations that allow us to connect across and center on community just feels so opportune, and why we're so appreciative for this space and your leadership and the collective leadership that's here.
Thank you so much, Abby. And it's really important and helpful, I think, to have your perspective, right? As sort of a leader, right, in the public health space, it feels very important to me, having been doing this work for quite some time, to have Robert Wood Johnson sort of right out front leading on this issue and being very clear about the links between segregation and health outcomes. I know that those of us who do this work, we've known about those links for a very long time, right? But I don't think anyone will be surprised to hear me say that sometimes we all know, right, that philanthropy can maybe sometimes sort of take some time, right, to come to the same understandings or to prioritize work that communities are prioritizing and know should be prioritized, right? And so it's been so great to have Robert Wood Johnson out front and really being a philanthropic funder that has an understanding of these links. That understanding is critical for the work that needs to be done. And so we're really happy to have you here and appreciate your understanding of these connections and intersections. And so I'd like to move us on into some questions. And so Shoma, I'm actually going to start with you for this question. And you shared some stories that I think really were in answer to some of what I'm going to ask. And so I'd love to have you start us off by expanding. But as a grounding question to set the stage for the continued conversation, I do also want to say that in asking this question, Marjorie, you earlier spoke about the heaviness and hope that's present in this conversation. And so I'd like to get us started with something that takes us a little bit more in the hopeful realm, because there is so much heaviness to be had, right? And we'll continue to get back to the heavy. But I do want to start us out maybe with a bit of the hope. And so, Shoma, if you can share with us, what are some examples that inspire your work of people engaging and showing up in solidarity as they lean into work in the housing justice space? And I'd also like to ask, why do you think that engaging in housing justice work feels liberating for those who have chosen to engage?
Hmm. That's such a powerful question, Ashwin. Thank you for asking it. Often we say we underestimate the power of the joy that happens when people actually get to be part communities where people not only are they doing the right thing, but they're in proximity and in partnership and relationship. Um, and so if it's okay, I'll share a response with another story. So I remember a public health department in Laramie County, Wyoming. Um, Not necessarily what we think of as a hotbed of thinking of these types of issues, who had cobbled together the resources to house youth experiencing homelessness and had a huge not in my backyard response at the zoning commission. They were engaged at the time in another initiative funded by Robert Wood Johnson Foundation, in an initiative called an Equity Action Lab, which requires, as part of what it does, opportunity to bring communities together, including the people with lived experience of inequity. So they'd gone to the zoning commission, but they were in relationship with the youth experiencing homelessness. And they went back defeated to the youth. And what the youth said is, maybe you should start by not calling us homeless runaway youth. Like, maybe part of this is about reframing, they called it rebranding who we are. They said, I wouldn't want to be around that, but that's not how we like to see ourselves. And it's not how anybody will want us near them. And they realized, as they listened to the ideas that the youth had about what the solutions could be for homelessness, what they needed to do more than anything was what Abby was referencing below for the work of the Othering and Belonging Institute, is first they needed to create the conditions for belonging. And so they brought together, as part of this Equity Action Lab, and it designed a community gathering. And in that community gathering were the youth who shared their stories and their solutions. And third of the room were people who had been a part of the Not in My Backyard response. And in that moment, that Not in My Backyard response turned into how about my spare room response? Because what they realized was that these were not problem runaway youth. These were their future community leaders. And what they needed was not segregation, but investment. In the space of its 90 days, over 65 businesses and community organizations co-invested, first in stabilizing and providing supports to the youth. They housed over 50% immediately in that next 90 days. And then over the course of the next 18 months, they watched as the tenor of the conversation shifted, and community members not only had the land, but came together to actually build the housing for the remaining youth. And I think that if we're going to do this work, what happened in the community was a story of not just a restoration of youth to housing, it was a story of restoration of people to their best, to their souls. That's the best way I could put it. And there's something about that is profound and powerful and liberating. And while that's one story of one initiative, what we've seen in our work in Communities Rise Together in communities all across the country is, as Somali refugees and people who are former slaves and Wisconsin health professionals and ranchers get together to actually know one another, it's led to people giving their land so that people can grow their own fruits and vegetables. The investment in choosing to be a community where people belong. And I think all of these are early, but I think we can't get there without understanding that a core of what segregates not only our communities, but us, is our choice, our belief that we are better part. And our ability, and we have to actually hold a lot of attention and energy to try to keep that. But when we come in proximity with the joy and abundance that and the brilliance that's offered and what we have to gain when we come back together, when we get to restore that sense of self, it is magical. And so I'll share with you that in the state of Texas, another hotbed, I was just there earlier this week. I've been getting around a lot this week. So in the south of Texas, San Antonio down first, the health system was trying to say, what can we do to be about supporting housing and restoration? And it took a long time for them to grapple with. They were really early. They said, could we even say things like race and racism? Like that's how early they were at the beginning of the journey. But as they got out of their walls and into their community, as they saw what was really happening in the hundreds of thousands of men and women and children who live in the colonias, place where there were 282 cases of cholera because of poor substandard housing and substandard water. They realized that they had spent 25 years trying to invest in the health of this region, and things had only gone backwards. And that the real opportunity was to invest forward, to understand and acknowledge those legacies, and to be part of doing the hard work of the economic development, the investment in policy change, the investment in civic capacity building, and to do that in proximity with the leadership of the communities that are most affected. And I when I went back, I was their surprise guest at their CEO council, and they were having this discussion. They were immediately like, guess what? We've gone from 2% to 18% of our investments upstream. And then others were like, no, but there's midstream, and we're doing this much here. And somebody else was like, but generational strategy to really shift generational poverty in this region, that's where it's really going to be at. That's where we really need to invest. They'd gone from seeing them, they were so like, they were like kids. They were like kids. Like they felt like what they were doing would have generational impact, and they wanted to be a part of it. One of them, who had been a huge, what is this? I'm a healthcare professional, had gone on to get her MPH because she's like, if I'm going to be a COO of this organization, I need to understand and be able to lead differently. And I share all of that because this isn't simple. Abby, that line you read was so powerful. It's one sentence, but there's so much to changing that. But part of what we have seen, and I think what brings me hope, is that in every one of these places that gets politicized as if they're homogeneously made up of people who wish in their core to not to have people live apart. And I have no lack of clarity about how politics and others drive health inequities. That's clear. At the same time, whether it's this health system or Meals on Wheels unit that was building housing and had done points in time count, only to find that the sheriff had jailed everyone so that there was a homelessness count of 0. I mean, you see in these places, at the same time, the juxtaposition of the political and structural and the narratives that drive the othering, and the narratives that drive the people who are lining up to say we can be part of force for restoring, for uniting, for reintegrating, and not from a place of losing the diversity of our identities, but from a place of recognizing that it's our diversity that makes us beautiful and powerful, that gives us all the pieces of the puzzle we need to thrive together.
Thank you. That's so wonderful. So I'm going to follow up on that and bring in Megan and Marjorie around a similar line of questions. And then Marjorie, we've also got one question that came in on the Q&A box, and I'm going to throw that to you as well. So I do want to note that we're getting some great questions in the Q&A box. So please don't hesitate to keep sending those in, and we'll weave them in as we can. And so Megan and Marjorie, I wanted to speak to you about the unique position that public health leaders are in, right? To mobilize people to act on issues like housing justice and remediating the harms of segregation. And so I'd like to ask you to share a little bit more about how this unique positioning has impacted the work to provide safe housing and improve health outcomes. And then relatedly, Marjorie, I'm going to ask you to speak to any challenges that you may have in getting buy-in from university administrators for your work. And I'll re-ask, don't worry, but just want to kind of get you thinking. And so Megan, again, a little bit more about the unique positioning and how it's impacted the work to provide housing and improve health outcomes.
Awesome. Yeah, thank you so much. It's such a pleasure to be on this panel and be able to like start to
Uh-oh, I think Megan is frozen.
talk about segregation.
There we go. You're
Sorry,
back.
I'm sorry, guys. My
Nope,
internet
no
is
worries.
unstable. It just told me. So
It happens to me every
so,
day. So don't
there
worry.
we go. There we go. So I'm just I'll repeat myself, is that it's a pleasure to be on this panel and to be able to pull threads through. So I'm going to pick up a thread from Abby. I'm going to pick up a thread from Shoma around, I think when we talk about these segregated communities and the maps and the inequities, we sometimes can lose the assets, the strengths of these communities. These are incredibly rich and diverse, wonderful communities. And so one example is some research that we've done around low birth weight and in certain neighborhoods. And when you look at the effect of communities just without any dimensionality, you may or may not, we actually didn't see a huge neighborhood effect. But when we pulled it apart and we said, wait, this community is being environmentally unjust in terms of its exposure to, pollution near a highway, getting a lot of particulates, PM 2.5, and how that affects, then you start to see the birth weight effect. But this also is a community that has a lot of immigrants with their wonderful social networks and supports and churches and healthier food habits and other things like that. And so then you see that as a positive factor, that immigrant enclave effect. And so what it kind of says to us in some ways is that these communities have everything they need to be healthy. It is the structures that choose to impose on them the lack of financial resources, the environmental injustice, the lack of housing justice. And so I do think it's really important for us to, I just want to lift up kind of Shoma's joy. And I want to lift up kind of this, that when we talk about redress, it isn't about moving everybody to the suburbs. Like, my patients want to continue to live in Roxbury. They identify with that. That is their generational home. It's about how Roxbury can be a healthiest zip code. There's no reason it has to be the unhealthiest zip code. It's the systems and structures that make it there. And so the example that I'll bring forward is, we heard from community over and over, they wanted a healthy grocery store. They wanted a place to go that they could go at the end of the day, pick up a meal, that they didn't necessarily want to cook, and they wanted to be able to see their friends and get things. And the reality is that we heard about an opportunity to invest in a grocery store because no bank was going to invest in this first floor of this affordable housing development, right? And so you're trying to bring housing justice, you're trying to bring this new housing development forward, and the first floor was going to be empty. Or worse, the first floor is going to be a fast food restaurant or a corner store, right? Because those are the places that could financially invest in this neighborhood, and no one believed that they could do it. And so part of our way of redressing was to bring forward a no interest loan to be able to attract a grocery store, and then further, kind of as the evolution, this happened, we made that investment pre-COVID, and then now COVID hit, was actually the operators envisioned not just a grocery store, but a halal market with a cafe and a halal butcher shop that celebrated the African diaspora, because the largest mosque is in Roxbury. And this is a neighborhood of multi-generational African Americans. And so we were able to say, great, let's lean in to help you not only be able to do this and redesign the space, but also potentially own the space. We're going to try and condoize this market so that they can own the real estate, so that when this neighborhood continues to gentrify, they're not going to get priced out. And all of those are like ways in which we can work with the systems to change the economic status quo, to be able to bend it towards justice, to be able to bend it towards wealth building. Because I think these are really important, that we do this work tangibly. It is really important for community to see that they asked for a grocery store and they got one. And then not only did they get a grocery store, they got a grocery store that reflected who they are. One of the favorite moments that the operators or the owners of the grocery stores shared was they were really intentional about what they put on the shelves. They're really supporting 20% of the shelves is with BIPOC owned businesses and making sure that they're there. And one of them was a Band-Aid that was different flesh colors. And somebody said, "I feel seen." So just being able to feel seen, and I'm sorry if I glitched for a second, is a powerful dignity that is hard to measure. We always want metrics, and don't get me wrong, I'm a researcher, I love metrics, but that dignity and that tangibility is really powerful.
Yeah, thank you, Megan. That Band-Aid example is real. My 5-year-old and I have had a couple of conversations about how mommy didn't have brown Band-Aids when I was a child, and he kind of can't believe it. And so now every time, because you need a lot of Band-Aids when you're 5, and for things that Band-Aids don't help at all, actually. And now every time he gets a Band-Aid, he's like, "Mommy, remember that you didn't have these?" And I'm like, "Yep, son, I do remember that." And so, yeah, there really is something that even a 5-year-old knows, right, about the importance of being seen. So I really appreciate that example, Megan, for sure. Thank you. Okay, Marjorie. So yeah, we'll ask you to share your thoughts on that same question, right? If you could share a bit more about how public health leaders are positioned uniquely to mobilize people to act around these issues. And then also speak to the question of whether or not you've had difficulty in getting buy-in from your colleagues for your work. If you can share around whether you get pushback at that level when pointing out the relationship between structural racism and outcomes. I think that feedback in particular and that insight can be very critical for folks who may be working in academia and have an interest, right, in sort of how they can create buy-in or address any challenges.
Well, I have to remember that I'm being recorded here, so I'll have to think about using my words appropriately. But just to say, I think that this is actually a unique moment where public health has an opportunity to actually get out of the lane, which I know we've been trying to do for quite some time. And there's been an influx of resources for unfortunate reasons, obviously, but have created an opportunity for public health to reimagine, to think about what we could be doing differently, and to think about the opportunity to partner with community, and specifically to bridge and to work with community organizing groups. And so I specifically want to call out community organizing because I feel like that is one of the ways forward for public health to better ground our work in what needs to be addressed and how we go about doing it. And there are numerous examples across the country of this happening. And I would just call out our cousins over at Human Impact Partners, as we like to call them, another organization nationally reaching many public health and community organizing groups who have been explicitly working to help foster that bridging that is necessary between public health practitioners and community organizers. And I think I would never claim to be a community organizer. I have so much esteem for those who are actually community organizers. And I am trying to take a page out of that book and to learn how to work in that way, to think in that way, to strategize and collaborate in that way. And so maybe to your question on how to think about the struggle that is true when you sit within any institutional setting and are trying to do work that may not always align with the precedents of that institutional context, there's an inside-outside game that you have to play. And so I, again, don't claim to be a community organizer, but that power analysis is real and you have to do it. You have to think about the context within which you are operating, that everything is politicized. You cannot pretend that it isn't. People have an agenda. There are contested power spaces that we are all working within. And we have to listen and learn in order to be able to understand that tug of war. Don't get me wrong, I don't want to use a bunch of battle metaphors to try to create the world we aspire to live in, but it is a reality that we have to acknowledge the tug of war that exists. And so from an academic perspective, me as a researcher, I have to correctly take stock of the institutional context within which I have chosen to do the work that I do. And that means that I might not be able to say all the things to the nth degree that I want to say, but I certainly can make the connections with those who are organizing in community spaces and do my best to bring all the tools to bear that academia can offer to support the social movements and the organizing that's happening in local spaces. And so I would say I don't necessarily choose my words carefully, but I do my best to appropriately understand the context within which I'm operating and to think about that inside-outside strategy and who is best positioned to be speaking outwardly on these things and what can I do to be part of the change that I want to see happen. I will say that government power, clearly, it goes both ways. We've got a history of government power being abused. We've also got the opportunity to see government power be redirected in this space. And I bring up government power because many universities, like the University of Wisconsin, are state-based. I am a state employee. And so thinking about that, just want to acknowledge that there are people who are champions and advocates for health equity that exist within government context. And finding the right ways to allyship and build those networks of infrastructure for public health practitioners who are equity champions is the work we need to do. And we at the Institute are actively trying to be part of that network building, along with Shoma and Megan. I know they're doing this work as well.
Thank you so much, Marjorie. That's really great. And especially really appreciate the comments around the importance of organizing, right? And I think it's important to know that we know, right, that communities are organizing for redress around, right, the disparate health outcomes. We've seen, I think, particularly within the last couple of years, a real growth in the prominence of tenant organizers, right? And we've seen some real victories come from groups organizing around the rights of tenants to live in safe, stable, affordable housing that is not going to lead to, disparate health outcomes, and that is actually going to provide healthy environments. And so we see that work happening. And I really appreciate your specific language around the power analysis, right? That we know is happening. And it's been so inspiring to see tenant organizers, whether we're talking about in Kansas City or in Miami, right? And even the redress-led work that is happening in Milwaukee, right? Around the possibility of the County Board of Supervisors standing up a housing subcommittee that would be a permanent place or space to address some of these concerns and issues around substandard and unhealthy housing, right? And so it's been really great to see organizers on the ground move that work forward and bring forward policy change that will benefit communities. So very much appreciate that. I'd like to kind of staying along those lines, ask you all to share your thoughts on how might we do more to unleash the capacity of public health leaders to engage in the work of solving the housing crisis and redressing the negative impacts of discriminatory housing policies here in the United States and across the globe. I mean, I would imagine I'm not a, a public health professional, but I, certainly for folks who might be, seeing patients, I can only imagine how little time it feels like you might have to do anything else, right, outside of that critical work. So for folks who are in that space, right, how might we do more to unleash their capacity to really engage in this work?
Yeah, I'll jump in, and I would love Shoma and Marjorie to follow. I think a lot of it is it's teamwork, right? Like nobody does this work alone. And I think that for us at Boston Medical Center, one of the cool things that kind of on our journey as a health system doing place-based investing is that we've really also been thinking a lot about a place-based collaboratives. So ways in which we think of a Boston opportunity system. So we literally call the place-based collaborative the BOSS, because we play on Boston's acronym, but it's the Boston Opportunity System Collaborative, in the sense that we know this ecosystem has the talent, they just don't have the same opportunities. And so what are the ways in which you can intentionally start to say, I'm going to target these zip codes for special hiring initiatives. I'm going to target these zip codes for special preservation efforts, working with community land trusts. And I just want to give a shout out to our deep partnership with Dudley Street Neighborhood Initiative, which is one of the premier community land trusts and community organizing. And so we've developed in some ways this mantra that institutions need to change, not people. There's a lot of this individualization that Abby referenced and others that like, oh, if we just gave you more services, another worker, another navigator, is a default, unfortunately, now in the social determinants of health space. And I'm like, no, it's us, it's institutions, and others need to change. We have this thought of that community needs to lead. And so being able to create space for community to bring ideas forward and say, did you hear about this community land trust? They're short some dollars. Can you look at it? Or this community wants to start a neighborhood birthing center, but needs to get land. How can we start to show up in that? Like, these are the ways in which the good ideas need a place to come. And so being able to create that collaborative table takes effort, but is really important. And then finally, through trusted relationships, you make long-lasting change. And so trust is really, it's a process. It takes time. It needs to be cultivated. It needs to be continued. And so I just think this work, no one does this work alone. But the key is really, really to put a lot of effort into those collaborative tables, to reset the power dynamic, to really be to model collaborative decision making. And I think place-based work is not new, guys. People have been talking about it for decades. But I do think this focus on it, especially with large institutions like healthcare and others, hopefully showing up with some humility, is I think has the potential to maybe start to see more progress in redress moving forward.
Thanks, Megan. Marjorie or Shoma, any insight you want to add there?
Just build on what you were talking about, Megan, because I think this work can't happen in an exam room. And so helping people know different places and spaces and assets that they don't have the heroes saving people, frankly, either in the exam room either, but rather they can join those tables. So for the last 2 years, I've had the privilege of watching a story evolve in Rhode Island as we led a statewide demonstration, really led and funded by both EOHHS and the Rhode Island Department of Health. They had health equity zones. And we said, what if we could build teams across these health equity zones that brought public health leaders and community leaders, healthcare leaders with community health workers as sort of key civic enablers within that. And as they did that work and use something called the Pathways to Population Health Equity Framework, which says, all right, here's what you need to do today, but what are the upstream community conditions and root causes that are driving these things? What are the assets and who are the other partners and groups that could help address that? Mm-hmm. Suddenly they shifted from a place of, we're going to do the short-term immediate thing, which is absolutely where they started, to as they gained as the community partners came in, as their leadership was prioritized and centered, what we began to see is systems and now an entire state that is motivated to move housing, affordable housing for everyone forward. And the conferences after, not only were there actual investments in housing, a lack of clear understanding of how segregation and housing and asthma and health outcomes was related, there was a readiness of those health systems to stand with those who are working in community development and with community organizers and groups. And there's a willingness to say at the state level, how do we solve this together? Like, what does it mean for us to really understand and solve this as a challenge? And I'm not saying they'll have all the answers or they have all the resources yet, but the level of investment and the understanding that for who do we feel, how do we feel about people experiencing homelessness? Do we feel they belong? Do we want them to belong? What do we mean when we create the conditions for people to belong? And then how do we, as they did in Delaware, take one step even before that to say, who is ending up in this population? And it turned out it was youth in school to prison pipelines that are falling out from discipline policies and youth in foster care systems that are growing up without the supports that they need because their families are in neighborhoods which predispose them to end up in poverty and to end up not being able because if one parent is in prison, it's pretty hard for the other parent to be able to make it. And with the policing and the removal of children from Black and brown families as a system that was about, we're going to save the children versus we're going to create the conditions for families to thrive. And it all gets back to, I know, Kashran, you've been having us focus on housing, and it's so clear how the makeup of our neighborhoods, of our homes, of our land has everything to do with what happens, not just in health outcomes, but in life outcomes. And because those are so connected, what's amazing to me is as people are willing to go on a journey, they shift, their frame of the world shifts. As I think all of us on this call went on that journey at some point. And as we shift, what we understand assets are, how we think about the role of public health and healthcare, to not just be about telling people or educating people to be healthy or even passing healthy policies, but about restoring the underlying conditions that lead us to not have what we need to thrive, that those economic drivers and social drivers of belonging in our neighborhoods that are encoded in place. I think there's a commitment or increased willingness or readiness to put assets in. I still think it's a really long way. People in public health and healthcare are used to having the answers. They're used to thinking they have to have the solutions, and they feel that overwhelms them. And often we don't understand the assets we do have because we see ourselves as beleaguered people on a hamster wheel. If you're a doctor, and I'm a doctor, who have to like save the world and this person in 15 minutes. What's liberating is when we know we don't need to do that. We need to be part of a team that's liberating the assets of the health systems to be able to reinvest just as many people who are here at the Healthcare Anchor Network are doing, to say, what does it look like for us to be the ancestors that create the different structures and systems and policies that create the nation in which we all belong.
Thank you so much, Shoma. And actually, that brings me, I think, to I think that's a really great segue, right? As we work to become those ancestors, right, that have sort of put great and helpful things in place. I want to turn to the Q&A box where we have some specific questions, right, around how we can all get to that place and how we can be doing that work. And so one attendee has asked with regard to the grocery store example, for instance, right? How do we counter, or sort of fight back on the argument that, for instance, grocery stores have to close or aren't present in certain communities because of high crime rates, right? Sort of how do we operationalize some of what we are talking about, because I think those of us who are, doing the work, we know, and I know that you all know this, is not as simple as showing up, right? And saying, we got to stop segregation because it's leading to bad health outcomes. And I think that we do ourselves a disservice by not sort of like accepting and understanding that sometimes the bad outcomes are the goal, right?
Yeah, totally.
To this point about all of these systems and segregation not being a mistake, right? And so how do we operationalize some of what we're talking about so we're not showing up and saying, oh, segregation is bad, and then just hoping that things change, right?
Yeah.
And so how do we push back on some of what we hear that is intended to just keep segregation going?
Yeah.
Megan.
Yeah, I'm going to jump in and then definitely welcome more people. It really comes down, and I think Shoma alluded to this earlier, like it's economics. Like housing is a manifestation, and what's different in the neighborhoods is a matter of economics. And I'm obviously a huge fan of Matthew Desmond, and Evicted was an amazing book, but also his more recent book, Poverty by America, which basically talks about like people make a lot of bank off of poverty. And so when we think about this, I end up starting to think about grocery stores in a very different economic model. And I'll joke a little bit. I know more about opening a small business now than I ever thought I would before I went to medical school. But it really is about like a healthy neighborhood needs a grocery store. And grocery stores actually survive on very thin margins. It is not a place to make a lot of money. And a lot of times when you look at, say, a corner store doesn't make money off of food. It makes it off of tobacco and lottery tickets is where they make their money. And so as we think about like commerce in a neighborhood, one of the things that I think is a trap is to not think that you have to create a different economic model to get a different outcome. And that's why you have to be thinking differently, in my mind, about impact investing and, frankly, reparative investing, because people missed out on the generational wealth. They are not going to be able to start their small business. They're going to need to have different social networks. A grocery store may be more of a social enterprise, a not-for-profit that requires some level of subsidy to be healthy in the short term. And we should all accept that's okay, because there's so many benefits to having a place to have healthy food that it's worth subsidizing it. And so as you think about kind of like crime rate or other things, what are the ways in which you could offset some of those risks? Because we use the word risk a lot when we talk about financials, to be able to create that safer space, to be able to have it. What does the funding stream look like? How do you be able to work on it? Because I will say a lot of the financial stuff that I've learned, and again, I'm a doctor learning finance, but it is this kind of going to the lowest common denominator of the people with money dictating the terms. And so how do we reframe the conversation to be like, how are we using economic power towards being our best ancestors? And that is a very different economic model that we should feel good about arguing is the right approach to redress. And that gets, I think, really different. I spent a year learning about urban planning. I did not get another degree, but I was trying to understand like what does a healthy neighborhood need? And it's interesting, there isn't a like perfect framework out there around like you need a library, and you need these third spaces, people to hang, places to hang out that are safe. You need, places that have good, greenery and other things. And so how do we start creating the financial mechanisms to making every community healthier? I think if you do that, segregation will go away because people will integrate, right? They will vote with their feet. But I think right now we have such structural things that are making certain neighborhoods have access to resources and certain neighborhoods not have access to resources, that we have to be able to tip the scale and be able to do that in a more intentional way.
Thanks, Megan. I think I would say that those certain things, right, are mostly white supremacy, and tipping the scale away from white supremacy. It's been hard. It's been hard, but that doesn't mean we shouldn't keep continuing to do it, right? But it certainly isn't easy.
Yeah. Thank you for naming that. Is exactly right. This is, the system will perpetuate itself without real intentionality to undo the white supremacy, to undesign the redlining. So thank you.
For sure. Yeah. Shoma, please.
I know I certainly agree with both of you. I think it's impossible to define this as only an economic issue without understanding the impact of racism and colonialism in that these are mechanisms, again, to sustain a false hierarchy of human value. There are people who do believe that income inequality and wealth inequality and life inequality should be preserved. The good news is that's actually not the vast majority of people. The vast majority of people believe things should be fair. So what's fascinating that we found as a way of getting the conversation going. So, Megan, at some point, we actually did build a whole set of policy libraries based on what would shift from an adversity economy to a well-being economy, based on stories that community residents had in their homes of people who were experiencing an inequitable economy and how they framed what that means. And I'm happy to share that as a follow-up resource. But one of the things that's been really powerful in that is the power of stories to system change. And so in that case, as people told their stories, you could map the system underneath the stories. And then you could map the assets that we collectively have against those systems and the ways in which someone has figured out how to disrupt a particular piece. Turns out with about 7 stories, you can see 90% of the picture. And that's enough to give people a sense of we could do this and this and this. If you collect enough of that, you see, oh, yes, it's economics, but it's it's a lack of capital for Black small businesses and patient capital that isn't going to create the conditions where it puts that person in worse debt. It's trauma-informed financing. It's restorative financing. And so in places like New Zealand, which are farther ahead than we are, there are Indigenous change makers who have been all about how we restore us to ourselves, how we restore and actually move the money in a way that's reparative and restorative, both at the level of who we are as a civic body, as well as just the groups of people that have been harmed. In their case, it was Indigenous people, what that meant in terms of land and resource back. And the gift of that has been new paradigms of how we change our relationship to money, which is a tool, change our relationship to power and one another, actually move the money, build the mechanisms to do that, and then change the policies that create and encode the structures and systems, which are sometimes public policy and a lot of times organizational policy. And I think our ability to have methods to be able to analyze not just the problem, but how we could solve each of those points. None of that is simple because it's not simple, but it's possible. And I think that at some point we have to stop doing all the work around things and start doing the thing that's needed. And I think that requires courage to say that we can erase those spots on the maps, but we can change the story of the 2 kids born in the same hospital who grow up 2 miles apart with a 20-year gap in their life expectancy. And that part of the way that we do that is by making the choices today that will change those stories over the next generations. That requires action. It's going from all of us seeing ourselves as part of that. It doesn't matter what our field is. That has to be part of how we engage in the work of restoration, maybe of the highest ideal of the American dream.
Awesome. Thank you so much for that. Thank y'all for that insight. I'm going to ask quickly 2 combined questions, and then I'll turn things over to you, Abby, to share some final thoughts as we get ready to close out. But I can't not ask these final two questions, because I just continuing on the theme, right, of sort of ways that we address specific challenges. I think it's important that we at least briefly discuss these ideas. And so the first question for any of the panelists who just want to share their thoughts is, in your experience, right, what have you found to be the optimal interaction of the public and private sectors in creating sufficient, safe housing, right, that doesn't just continue to perpetuate segregation in communities? And then relatedly, how, in your experience, how do we create neighborhoods that are attractive to, or that retain individuals that we might think of generally or colloquially as gentrifiers, without pricing out existing families that have been longtime residents of those communities? So how do we create, right, great housing that is not just following patterns of segregation? And then also, how do we create neighborhoods that are attractive as, you know, amenities come in, without pricing out existing families in those communities?
I'll jump in quickly. I put in a couple of things in the chat or in the Q&A section around, I do think creating, again, financing mechanisms around mixed income neighborhoods. We focus a lot on extremely low income housing, and that's really important. But then that middle tier, right? The person who's working as a community health worker in Boston making $50,000 a year, which is 50% of the area median income, which is $100,000 a year, like they have no place to go because they're not low enough income for certain things, but they obviously can't stay in the market rate housing. And so I think there are really good models. I put one in called the Healthy Neighborhood Equity Fund, which looks at gentrifying neighborhoods to be able to create these different income tiers. I will say one of the unintended consequences of income tiers is they can feel like a ceiling. So I do think we need to do policy change around how to smooth that process out. That's an unintended consequence. But I think there are models where you can attractively fund and finance and plan for, because what's really cool about that fund is they not only do financial scores on deals, they do health impact scores. And they only fund projects that meet a health impact score and a financial score. And then I also put in the chat, there was a really good question recently added by Kirk around this idea of urban planning. And I thank you, Shoma, for bringing out. I don't want to imply that there isn't amazing policy toolkits. I just know the Boston Planning and Development Authority isn't using them. And so that's the issue, is like, how do you get these like amazing frameworks into action? Because they're really good at talking about wind shear, and they're really talking about traffic flow, but they don't talk about the fact that there are processes of how they do quote unquote community engagement, and the richest, whitest people show up to those meetings and use the democratic process to perpetuate the white supremacy of urban planning. And so I do think there needs to be ways in which we reset the urban planning process. And Professor Katie Levine Einstein has done some really great research at Boston University about how to do that, where you really make urban planning inclusive. So just want to give a shout out to both of those references.
Thank you so much, Megan. Thank you for weaving that in. I was hoping you would. So thank you. Marjorie or Shoma, any thoughts you want to share around sort of how we create housing that is sufficient, safe, stable, affordable, or how we protect against displacement in communities that are gentrifying? Any thoughts? All right. Oh, Marjorie, were you
No, I was going to defer to Shoma because I saw her come off mute.
All right. Shoma, do you have anything else to add there, or?
I mean, I'm going to say something, and it may be, so Damon Drummer, who's now at the new school, would say that part of what we need to do is not redress a thing that we did as a federal government as we encoded in inequities and expect only those who are in private developers to bear the brunt of that. And so part of what I think about is, what is the investment? Someone asked earlier about public-private partnerships. I think all of that is important. And Meg and I agree that it's actually critical to avoid the fiscal cliffs, the cliffs of benefit cliffs that exist. But I think part of what we need to begin to do is see this as a reparations issue. That we need to stop thinking this is going to be solved without real investment in building housing that require neighborhoods and choices that people and neighborhoods make that say that a certain portion, actually a significant portion, has to be diverse. That can you imagine that if we have to have scores that your federal funding or your amount of tax base wasn't based on locality, but was based on where equity gaps needed to be closed, that's where funds flowed. That's actually how other countries do it. They actually, they think the idea of taxes being local, they know that that's a policy that is a segregating policy. And so I think part of what we need to begin to think about is not just what is it that one group needs to do, but how do we as a system take ownership of the legacies of harm that we've created? And then how do we invest both in neighborhoods and in people, in families, in communities, in a way that creates the wealth that actually means they have what they need to do? And there are interesting experiments of what that looks like with community-driven solutions and access that Family Independence Initiative and lots of other groups are doing. But I think somehow we need to change the shape of the conversation to be about not reparations that's about blame, but about restoration that allows us to actually get out of the situations that we collectively are in as a nation.
Thank you, Shoma. I really appreciate that. As I turn things over to Abby before we close out, I really appreciate you sort of reminding us, right, that there's no particular reason why we have to do things the way that we've always done them, right? We really are only limited by the shape of our dreams. And so I very much appreciate you bringing up for us sort of how other places have figured this out. That feels very important as we wrap up today's conversation. So thank you very much for that in particular. And with that, Abby, I'll turn things over to you for any reflections or thoughts that you might have as we wrap up today's conversation.
Sure. So thank you to you, Kushana, for creating and holding this space. Again, I'll end where I started, which is just enthusiasm for your leadership in bringing us together. You know, I did say that sort of this question of what is the role of racial residential segregation and health was the question. I didn't say it was an easy question, right? And I think the conversation exposed the complexity of it. But there are three things that I'm walking away with. One is that we need to be asset-based in how we approach this work. Two, that we need to be bridgers and we need to support bridgers. And three, that we need to sort of hold the both and. And so let me just say a word on each of those. This work is hard, right? We're talking about, you know, tackling white supremacy, you know, embedded structural racism, and it can feel impossible. And I think over the course of this conversation, there were incredible stories of progress. The one story that I will just sort of acknowledge was the conversation between Megan, you, and Kushana about the Band-Aid, right? Like in our lifetime, we can see change that enables people to feel seen. So that wasn't about housing, it wasn't about community development, but it was an example. And sometimes we need those examples to hold up to remind us that, you know, change is really possible and that we can be a part of it. So, so much to say there, but we all, I think, have platforms to use for those stories to lift up the assets that exist in the communities that we are looking to engage and serve, and that change is possible. Bridgers, Marjorie talked about bridging between, public health and academic institutions and community organizing. That is absolutely what we need to do this work. Megan didn't say it explicitly, but we might have forgotten at points that she's in a hospital and a healthcare system talking about doing investment work, right? She is bridging two big types of institutions and practices. We all need to think about how do we create the conditions for that. And this is lastly both and work. And we need to be thinking about how do we invest in people and place. It's not one or the other. We need to be thinking about how do we address sort of the manifestations or the symptoms of racial residential segregation while also addressing sort of the cultural underpinnings, right? So you need to be thinking about parks and green space and environmental justice issues. At the same time, we're thinking about, how do we shift the culture in our country to value everybody? So I just offer those as, things we can take away to sort of bring into this work that is incredibly complex, but necessitates all of us and conversations like this. So again, thank you to the Redress Movement for creating this space.
Thank you so much, Abby, and thank you so much to our wonderful panelists for today's conversation. You've all given us so much to hold, and I know that I've learned so much. And so Dr. Megan Sandel, Dr. Shoma Shaha, Dr. Marjorie Givens, thank you so much for your time today. Abby, thank you so much for joining us, for your insight, for your words of wisdom. We very much appreciate it. I also want to give a huge thanks and really my heartfelt thank you to all of today's attendees. There are so many community partners across the country on this call, and we here at the Redress Movement know that we are here because of your interest and because of your engagement. Many of you have come to the organization after having read The Color of Law and or Just Action, and we know that you are excited and you are engaged and you are ready to address and remediate the harms of residential segregation. So we see you, we appreciate you. The folks who are joining us from our redress roundtables, thank you for being here. Thank you for your engagement in Denver, in Milwaukee, and Charlotte. We appreciate the work that you are doing to identify and to promote solutions to residential segregation in those communities. And so we thank you for partnering with us and being a part of our work. For those of you who would like to learn more about the work of the Redress Movement, please visit redressmovement.org. And I believe that a link has been posted in the chat. I do want to invite you all to please be on the lookout for email and or social media announcements of our next webinar in the Lessons from the Field series. Again, thank you so much to our panelists for being here. And thank you to all of today's attendees for your participation. Thank you so much.
Thanks, guys. I'm going to hop off, but it was such a pleasure. Bye.
It was a joy.
Bye-bye.
Thank you.
Thank you, Kashana.
Thank
You were amazing, Kashana.
Yeah.
Thank you all.
Congratulations.
Thank you so much. Thank you for being here. Excellent job. Thank you.